Hello, Namaste. I'm Dr. Rajeshwari Rapata speaking here on the Instagram page from Sai Sanjeevani Online Homeopathic Clinic. You can also watch me on YouTube, The Art of Healing Gurukul. Today's topic I'm going to discuss is constipation in children. So constipation, what is constipation? How would you define constipation? How do you understand your child is suffering from constipation? Usually when a child passes less than 3 stools and then there is difficulty in passing the stool, it is called as constipation. The child may pass less than 3 stools per week and there is severe difficulty in passing. The child becomes irritable, there is bloating of abdomen, there is pain in abdomen, there are so many associated complaints along with it. Now, this constipation can be due to various causes. There can be because of a wrong diet, or it can be because of inactivity of the rectum, it can be because of the inactivity of the anal sphincter. So there are several causes for constipation. And then when you take to the doctor diagnoses the complaint, diagnoses the symptoms, and then gives the suitable remedy. Most of the homeopathic medicines are based on the symptoms of the child, and then the medicines work so well that the baby gets cured, the child gets cured within 2-3 days. I've seen wonderful results in children, even in infants who have constipation. So the first remedy which we are going to discuss is alumina. Alumina in 30. I have given alumina in children who have usually who are being bottle fed with milk, and these children suffer with constipation. And here the child usually has inactivity of the rectum. Rectum is the end part of the intestine where the feces gets stored. And once the rectum gets full of the stools, then the child has a desire to pass stool, but yet it is ineffectual and it is very difficult and the straining is there. So this kind of baby has abnormal cravings. The child has a craving for indigestible things like chalk, charcoal, and sometimes the child, you see that the mother complains that the baby scratches the walls and removes the cement and the plaster and eats it. And this kind of child, when suffers with constipation, is given alumina. Then the Nux vomica is also there. The Nux vomica is also a very good medicine for constipation, and here the child complains of a constant but ineffectual urge to pass stool. The mother complains, says that the child always goes to the toilet, passes a little stool and comes back, and again goes back to the toilet. So there is an unsatisfactory stool, and because of this constant urging and then the uneasiness in the abdomen, the child becomes very irritable and angry and crying, demanding, and all these symptoms happen, and the mother comes with all these complaints, and the baby, when given Nux vomica, the immediate effect cure happens. Another medicine which we usually commonly give in our clinic is Bryonia 30 in 30 potency. Also in lower potencies, when the child is a little younger, like a baby. So in Bryonia, you find that the child has lots of thirst for large quantities of water, drinks water frequently in a glass full of water, he just gulps it down. And here the constipation is hard, dry, knotty stools, big stools, and sometimes it is streaked with blood because of the straining and because of the big size of stools. And Bryonia works well, especially in these winters. I have given many children who suffer from constipation. Bryonia works very well here in winters. Another medicine which we give is opium. Opium, the baby itself, the appearance of the baby itself tells that this is opium baby. and the dull appearance, the drowsy, the baby when sitting on the chair itself droops silent and just feels like drowsy. And when we ask something to him, he is not in a mood. Seems that he is not in a mood to answer, and then slowly he'll answer the questions. So the response is very slow. And this kind of baby has a absolute inactivity of rectum, because of which we feel that is a constipation. And then there is hard and dry stools. The stool is very thick, sometimes black, and sometimes streaked with blood also. So all these symptoms lead to opium. In the villages where the small babies are kept home and the ladies go out to work on the fields, they are usually fed with opium, and then all the 7 to 8 hours the baby sleeps in the cradle, and evening when the mother comes home, then she feeds the baby. And these kind of children have this kind of constipation, opium child. But not only because of feeding opium, the children in the villages or in the tribal areas, but even without it, when we have the symptoms, opium is given in potency form to the children, and it works wonders, and the baby is absolutely cured. Then we have cuprum met. Cuprum met indicates the spasm, the spasmodic pain, the cramp-like pain, which is associated with the hard stools, ineffectual stool, the colicky pains itself, where the baby holds the abdomen while passing the stool. And here, cuprum met is indicated. The spasmodic, crampy stools, crampy pain associated with the stools. And that's where we give cuprum met. Another one important medicine which I have frequently given in babies who can't even express that they have constipation. The mothers complain that the baby is unable to pass the stool, and the stool just comes out of the anus and recedes back. So the mother is so confused. She tries all the things, holding the head, the legs above, and doing all the sorts of things. The grandmothers struggle for the baby to pass the stool, but this ineffectual stool, which just comes out of the anus and then recedes back. And this kind of baby who is very frail, nervous, chilly, and when given silicea, it works wonders. This kind of babies, if not treated at the right time, they have this recurrent complaint of receding stools and inactivity of the anal sphincter, because of which this happens. And silicea gives immediate results. So just keep wondering that how homeopathic medicines work. I have given so many this kind of medicines to cure constipation, and where lots of other medicines, the anal pessaries which we give, all these have failed in front of homeopathic medicines. There is other thing also related to constipation, when one has to correct the diet, especially when there is a nursing mother, has to take right kind of diet, not be stressed, and also if the baby is feeding, should have lots of fiber in the diet and should have plenty of water too. So these are some corrective factors in relation to diet. The baby or the child should also have enough physical activity. So this will also help in treating the constipation correctly. So this is for today, the constipation and homeopathic medicines. Keep watching my videos on Instagram. Do follow my Instagram page. Also subscribe to my YouTube channel, The Art of Healing Gurukul, which is on YouTube, and subscribe to it. I'll see you there too. So keep watching. Until then, see you again tomorrow with another topic related to children's ailments. Bye bye.